Hello, I'm Rick Anthony, and this is Caregiver Assist, a series of 30-minute episodes in which we interview experts in the field of caregiving, as well as other men and women who have or are caregivers for their loved ones. Inspired by my own experience as a full-time caregiver for my late wife, each episode includes information that we hope is helpful to other caregivers. In this episode of Caregiver Assist, we have as our guest Dr. Jeffrey Hausfeld, who for more than 20 years led the field in otolaryngology, if I can't pronounce it, and facial plastic surgery. He subsequently retired and has become a successful businessman who is operating, owned, and providing counsel to various healthcare ventures. One in particular that I have a special interest in, and that's a series of special assisted living facilities for people who have Alzheimer's and dementia, creating a very special environment. We'll be talking more about that later. Jeff, thank you very much for being here. I appreciate you taking the time.
Rick, it is always a pleasure to talk with you.
Thank you. As I recall, we first met when you were still making the transition from being a practicing physician into the wild and woolly world of entrepreneurship. As I remember, you took the time off to get your MBA at Johns Hopkins.
That's correct.
And soon after that, launched your new career. I don't know that I've ever asked you, and perhaps others have, why? Why did you give up a successful practice in the Washington, D.C. area, which I'm sure was very lucrative, I hope it was, and a complete career switch?
Well, I started very young because I skipped many grades when I was in high school, college, and even medical school. So I was at a point in life where I could make a change. And it's like you're at the top of a mountain and you say, do you want to stay at the top of this mountain? It's a nice view, but there's another mountain over there that looks really interesting.
Yes. And
you have to climb down your mountain and take the trek up the next mountain and be willing to sacrifice time, money, and, anxiety in order to make that journey. And I thought it was worthwhile. And the idea was to leave a bigger footprint. Because in medicine, especially in surgery, you can only take care of one soul, one person at a time.
Yes.
And over the course of the 24 years that I practiced, I took care of many, many people and hopefully improve their lives. But if you're trying to leave a larger imprint, then you have to take a step back and say, what are the other opportunities that I can do that? And that's what I've done for the last 15 years. Is
it 15 years already? Oh, my word. You look great.
Thank you.
You haven't aged at all. Your medical background as a caregiver, I would think, gave you an advantage in that you understood the clinical condition of your father-in-law, for whom you were a caregiver, you and your family. And you certainly understood how difficult it is to be a caregiver, and the mix of emotions and the stress, physical as well as emotional. Did it make it any easier, or was it just as hard for you as it was for me and others?
Oh, it was. They say that it's the long goodbye, Alzheimer's and dementia, and it truly is. Because my father was a very special guy. And it was because my father passed away when I was only 26 years old that my father-in-law really filled a void for me for decades. And he was a teacher, he was non-judgmental, he was caring, and he was a smart man. And to see this big figure of a person in my life deteriorate to the point where he doesn't know the name of his grandchildren, and he can't really put things that happened a few hours ago back into his data set. That it is devastating to see that happen to such a strong and confident individual.
Did he have Alzheimer's or another form of dementia?
He had Alzheimer's.
Was it remote? Did you live nearby, or were you caregiving by distance?
They moved from Brooklyn to our area in Washington, D.C., probably about 10 years before he developed symptoms. So they were here, and they visited frequently. He and my mother-in-law both worked in my office for many years, helping out with clerical and managerial things and small repairs that were needed. My father-in-law was very good at that. So yes, we had a very full and engaging life with them, and it was very hard to see that deterioration right in front of your eyes, with no possibility of a cure like there is today, or a delay in the progression, and to see the toll that it took not only on him, but on my mother-in-law, on my wife, on my whole family, because it takes a village to take care of people like this.
Yes. For me, the hardest part for my wife when she was progressively ill and then was diagnosed with dementia, the hardest part was the medication. I've said this before. Scary for someone like me, having to dispense medication and watching her blood pressure go up and down, and always the risk that I would over-medicate and have a reverse effect. I'd be calling doctors at 11 o'clock at night. What do I do? It was frightening for me, and I've talked to other people, and they've had the same experience.
Yes, and I can understand that. I didn't have that problem because I was able to understand the physiology of what was going on and the effects of medication. For me, it was when he got to the point where my mother-in-law could no longer care for him in their house, even with a hospital bed, even with people coming in to assist her, and we had to put him into an assisted living facility. That's when things took a turn for the worse, not only in his health, but in the care that he received there, which is what gave me the impetus to say, we could do better. We can help the most vulnerable population of people that are suffering from a chronic disease. We can treat them with dignity. We can treat them with compassion. We can treat them with respect and let them live out whatever lives they can live out, fully and engaging to the extent that they can.
Jeff, I know you're a religious, spiritual person, active in your synagogue. Did your spirituality enter into your ability to care for your father-in-law? Did it make it easier?
So I'll tell you a story that I was told many years ago. And it had to do with a rabbi, very famous rabbi in Eastern Europe. And people would come to his tish. Tish is a table. And they would ask him questions, and they would, seek advice. And that was a common practice in Eastern Europe. And around the table were his disciples, his students. And people would come in and sit at the table, and ask him for favors, ask him for connections, and ask him for advice. One day, a mother and father walked in with a handicapped young man who was unable to walk, who had to be assisted to sit into the chair. And the rabbi stood up. Never before did the rabbi stand up when people would come to seek advice. But this time the rabbi stood up. And the mother and father spoke to the rabbi, asked them questions, asked them advice, and he gave them advice, and they took their leave. And after they took their leave, the disciples asked the rabbi, "Rabbi, we understand that you see many people, and many people look to you for guidance. Why is it that this one person that came in today, you stood up for, and you never really stood up before for anyone?" And the rabbi said, "Because this young man who has such disabilities has given the opportunity for others to give to him and to care for him that other people really don't understand or can really grasp. And that makes this person have a direct link to heaven. And in the presence of that person, I needed to stand."
Yeah. I understand.
So that's the kind of thing that drove me when I think about that model of being able to give of yourself to someone who is more in need, who is more vulnerable, elevates you, elevates your soul, and elevates that person.
Some of the reading I've done, you've just reminded me of a phrase that caregiving is both an art and a gift, an opportunity to give back,
right?
To give of yourself, and that's what you're talking about.
Yeah, we look at it many times as a burden, because physically it's a burden, and emotionally it can be a burden. But
yes.
You always have to remember that you are giving of yourself, and the ability to do that is a gift.
Yes. The hardest decision that my family and I had to make was after the doctors at the hospital, Marlene's last visit to the hospital, said to us that they couldn't do anything more for her and take her home, put her in palliative care or hospice. It was hard accepting that and doing that, because in accepting it, I had to accept the fact that she was dying, that her fight to live was almost over. It was hard. It was very, very hard. I'm sure I'm not unique in that. Thousands, maybe millions of people go through it. But as you also know, I'm sure, it's a very personal experience. I can listen, as I've had, to what other people have told me about their experiences, and they're all unique. My experience was unique as well. Married to a woman I'd known for 70 years, with whom I'd been married for almost 65 years.
Yeah.
Shared a lifetime with. Only 16 years of my life I didn't know her. And all of a sudden, I wasn't able to do anything for her. I had to turn her over to other people, as we did when she was in hospice.
Right. And that's not an uncommon feeling, and one that, as a physician, we have to be able to control. Otherwise, you go down a deep hole of depression when one of your patients dies.
Yes.
So you have to maintain some detached concern, being able to take care of the next patient that needs your advice and care. And at the end, it's a release of the soul. And you have to look at it like that and imagine it like that. And what can you do to alleviate the burden on that person and make that transition from this life to the next easy and not painful?
Yeah. No, but the wound is always there. It doesn't heal.
No, but as time will show you that it does put things in perspective.
Yeah. I'm waiting for that time, Jeff. I'm waiting. I hope.
Yes.
You mentioned earlier that seeing your father-in-law suffer and get progressively worse, you concluded that there had to be a better way, and that was the impetus for your creating this, I think, 6 very specific designed special environments for people with Alzheimer's and dementia. We have some video of the environment that you and your colleagues created, the marquee for the theater, the marquee for the eating area, and so on. Where did that idea come from?
So I was introduced to these developers by my son, who did his MBA with me at Hopkins. We did it together. And he went on to do healthcare finance. And when I had left my surgical career, he said, "Dad, there are these 2 guys in the Chicago area that are looking to build their own facilities. They build it for other people now, but they need a source of capital. They need someone to help, manage the process. Perhaps you'd like to come out and take a look and meet them." I said, "Sure." So we went out to Chicago and met these 2 gentlemen, Steve and Steve, who were very knowledgeable and had built these facilities, had managed these kind of facilities. And what sold me was not going into the facility that they built and seeing what it looked like, But what sold me is that when we walked into one of the facilities that they had built a few years ago and sold because they were building it for a larger corporation. When we walked into this facility, 3 octogenarians saw them and hadn't seen them for years and ran over to them and hugged them and kissed them and said, "Steve, where have you been? We've missed you." Mm-hmm. I said, that's it.
Yeah.
That's the intangible. That's the connection with humanity that I didn't see in the places that my father-in-law was being taken care of. It's that connection that I said, these are the guys that I will do business with. Because it's that same hug and thank you that I received as a physician for doing an operation on somebody and not seeing them for 10 years. And they said, "Doc, you've changed my life." And that's what I saw in these 2 gentlemen. And we've been in business now for over a dozen years. And they have lived up to that initial impression in that they care about these people, they take care of these people, and that is the overriding impetus. It's not only the profit. And that's difficult to find in today's day and age.
Yeah. The design, again, the video that I picked up from Lincolnshire Place, is that replicated in the other 5, or is each one somewhat different?
It is. So there's always this big town hall in the middle with smaller activity rooms and sections that are for a beauty parlor, a movie theater, an ice cream parlor, a petting zoo, a place to do planting, things that people who are suffering from this can still do because they have memories from many years ago. So we have children from the elementary school come in and do a play. We have karaoke night. And the most amazing thing on karaoke night is you have, 40 residents sitting there and someone is leading the songs. And people who don't remember the names of their spouses or their children, if you play the anthem for the Air Force, they stand up and they know every word.
Yeah.
And the children come over to me, the children who are my age, come over to me and said, "Thanks, Doc. Mom or Dad is still here.
Yes.
They're still in there.
Yes.
Thanks for letting them bring this out and show us that they're still there."
The staff of these facilities are always very special people. Thank God made them to do the work they do.
And that, Rick, is our biggest problem today after COVID, is staffing these facilities.
Yes.
It has become a major issue in delivering the kind of care that we want to deliver for our residents.
I know we're talking about a caregiving crisis in this country and perhaps other countries as well because of the aging population and the multiple morbidities that older folks have. I don't know what the solution is, but somebody better come up with one. It's not going to be government, God help us.
No.
Maybe it's the private sector.
And using robotics and artificial intelligence in this population has only marginal effect. It really requires a personal touch. It requires the attention and compassion of an individual and the understanding of an individual who can say, "Okay, I just told you what you're asking me to do 5 minutes ago."
Yeah.
They don't remember that.
Yeah. A friend of mine, who is the CEO of an assisted living facility in our area, he's been in healthcare for 35 years, and he's always been an innovator in whatever he's done. And as the CEO of this facility, he just ordered 3 robots to assist in the care of folks in the memory care unit. And he's also working on some new technology for a television screen so it becomes a command center for all interaction, clinical, social, and so on. But I was really astonished when he told me about the robots. It's something very new, and he said that they literally go into a room to a patient, and they will have a conversation with them. They will emote some kind of emotional connection with them because of AI. It's, on the one hand, it's fascinating. On the other hand, it's kind of scary.
Yeah, and it's kind of sad that we have to rely on robots to do this, but it's our attempt to, fill the void.
Yes.
If we can't find people who are willing to do this job, then we'll create artificial intelligence and robotics that will help us care for these vulnerable populations.
As an aside, do you have any concerns about the rapid advancement of AI and all of its applications in healthcare, for example? Or do you see only upside?
Of course, you'd be foolish not to have concerns with any technology that comes on such a rapid rise to the forefront. That being said, there are truly some very interesting, unique opportunities and advancements that this will allow us to achieve, both in healthcare and in drug discovery. So stay tuned. We have to do things in a way that is both measured and deliberate, not stifling technology, but embracing it with some caution.
Do you think that, as a practical matter, either government or even the private sector can really regulate the advancement of and the use of AI?
I can only tell you that governments around the world are looking at this very closely, because they have been warned that, without some degree of regulation and oversight, things could go awry.
Yeah. The profit motive, as you very well know, is very, very powerful.
Yes.
And there are people who can skirt around those regulations if they're really intent on doing something. Thank God I haven't been in a hospital lately. That's not true. I was in the ER a couple of months ago. The environment is so different from what it was not too very long ago. And what I mean is, it seemed to me more sterile, perhaps because of all the technology, and because there weren't as many people as there used to be. Redundancy is a luxury that they don't have any longer, the healthcare facilities, because there just aren't enough people. Now, since that is a problem, and since you are an entrepreneur, do you see an opportunity to somehow increase the number of qualified people for institutions?
Increasing the number of people is always a hope, but you have to train them.
Yes.
They have to have the desire to do this, and they have to have the intelligence and smarts to do this. So it's not for everybody. They also have to have the understanding that taking care of others comes with a great responsibility.
Yes.
So medicine is not for everyone, just like law is not for everyone, or accounting is not for everyone. Some people are just wired for that kind of dedication and caregiving. Other people are not. Do I want to see it improve? Absolutely.
Yes.
Because right now, when you're a patient, you have to have an advocate for you. You can't just go in there, especially when you're vulnerable or unconscious or compromised. It becomes very difficult to get the kind of attention and care that you would have gotten when I was practicing, because there's less people there.
Yeah.
And many of these practices are now owned by private equity, and it's a very profit-driven enterprise. That being said, there are still excellent physicians and excellent surgeons and excellent nurses that take care of us. You just have to be able to find them.
But do the providers, the clinicians, the doctors and the nurses, understand and appreciate the role of an advocate? Because, as you know, it can become very contentious, as it did in my case. Needed information, wanted information, needed guidance or direction, and they were so distracted, or they were so much in a hurry, they weren't able to satisfy. Maybe our expectations were unrealistic, but it doesn't matter.
And I think that's the issue. The one thing that's not fungible is time. And that physician and that nurse has a responsibility not only for your wife and your loved one, but for 30 other people that are going to see them that day or that they're taking care of on that ward. So whereas as a caregiver, you're wanting information and advocacy for the person that you love and that you care about. What the physician and nurse has to be able to look at is how can I help everyone and not sacrifice that other person's health and well-being because I'm spending too much time explaining to you what has to be done. Yeah. It's a balance.
Yeah, I understand. What surprised me as I continue to study this and try to understand it, not only in my own situation, but as I became more aware of so many other people who have had similar experiences, is the lack of training for unpaid family caregivers, as well as paid caregivers. I interviewed a local nonprofit organization that created an academy to train unpaid family caregivers as well as people who wanted to pursue it as a profession. And they told me, and then I did some research, most of the training is online. It's not hands-on. Mm-hmm. The worst part is most of the people who need the training don't have the time to sit in front of a computer for an online training program. They'll start it and they have to give it up. It's not a question of money because all of this is available, it's free. But what the people who were running the program told me was they're heartbroken because they have this wonderful resource and people aren't taking advantage of it.
Yeah, and it probably would help many people if they had some basic knowledge about caregiving and what are the things that they have to watch out for and be alerted towards if things go in a bad direction. And potentially what these people could look at is giving them snippets as opposed to an hour-long webinar. What we do for physicians now is we give ourselves snippets. So, Medscape and Doximity and other platforms that doctors use to get information, we get it in 10 or 15 minute snippets. Because it has nothing to do with attention time. It just has to do with available time.
Yes, that's right.
This is your available time. You have 10, 15 minutes when you're taking a walk, when you're in the car, whatnot, when you're traveling from home to work. You can listen to something, get some knowledge, and not have to commit, 45 minutes, an hour and a half to a training session. So that may be a model that we should look at for teaching caregivers.
Jeff, that sounds like a business opportunity.
There you go.
As you know, that kind of training model has been developed for other applications, many of them.
Absolutely.
Yeah. As you look back, excuse me, again, you were uniquely positioned because of your medical background and your experience. What sticks in your mind about your experience as a caregiver or a member of a caregiving team, your family?
I guess what sticks in my mind is how the toll that it took on all of us. Because you do have lots of different emotions. You're grieving for the loss of that person's personality, for the loss of the ability to communicate. You're angry that it happened to them. You're denying that that they won't be here in a certain short period of time. And you're grateful for the fact that you had the years that you had with them. And for the opportunity to give back and care for them just as they cared for you.
Yes.
So you have to be able to put all those things together and say, I'm here for you. I thank you for all you've given me. And if I can make this journey easier for you and for the family, that's my goal.
Jeff, I really appreciate your time. I know you're busy taking the time to visit with us. My guest today has been Dr. Jeff Hausfeld, a good friend. This is CaregiverAssist. Until next time, take very good care of yourselves.